and it is April 27th, 2020. And welcome to the regular session meeting of the Durham County Board of Commissioners, our virtual meeting in this time that we are living in. I will now share the public charge. The Board of Commissioners asks its members and citizens to conduct themselves in a respectful, courteous manner, both with the board and fellow citizens. At any time, should any member of the board or any citizen fail to observe this public charge, the chair will ask the offending person to leave the meeting until that individual regains personal control. Should decorum fail to be restored, the chair will recess the meeting until such time that a genuine commitment to the public charge is observed. As a courtesy to others, please turn off cell phones during the meeting. I'll also ask everybody just to be careful who is in on the meeting to keep your phone muted when you're not speaking, and if you're using two different devices, to keep one of them muted, or else we get that echo chamber thing going. And now I will call for the Pledge of Allegiance, although I do welcome other people to join in, because last time it was just me alone and I missed having everybody else saying it at the same time. So I do welcome everyone to join in the Pledge of Allegiance. I pledge allegiance to the flag of the United
States of America, and to the
republic for which it stands,
one nation,
under God,
indivisible, with
liberty
and justice for all.
Okay, that sounded great. I like that. And now, are there any agenda adjustments? Hearing there are no adjustments, we'll move on to the announcements. We have a lot of announcements this evening, a lot of important information to share with the community, and this will be on our website. I'm not going to read all the details, but it will go out in the press release and on our website. Number one is to join Help Us Feed Durham. The Triangle Nonprofit and Volunteer Leadership Center has launched a one-stop volunteer portal where you can sign up to help nonprofits that are feeding our community right now. This will be continually updated, this page, and this is a great way that you can help. So we'll have the information about how you can help our community with food insecurity needs. Still time for the Census 2020. This is the first time ever that you can complete it by phone, email, or online. Due to the COVID crisis, the deadline has actually been extended to October 31st, 2020. We need everybody to complete the census. I have a special message from Deborah Craig Ray, who's been our champion of this. This is so important because the census is our opportunity every 10 years for the federal government to count the population of everyone in our country, in our state, and in Durham County. And this is the basis for how $676 billion worth of federal funding is distributed. So we want everyone to be counted. It doesn't matter if you are undocumented, if you're an immigrant, if you're a refugee. We love you. We want you to be counted. It does not have any confidential information for anyone when you fill it out, but we just need every baby, every person to be counted. And again, you can do it in so many different ways, and it only takes 10 minutes. And last count, and I'll let Deborah chime in on this, we were way behind other counties around us. in our participation level, and we really need to step up, Durham. So you can call 844-330-2020 to do it by English by phone, or 844-468-2020 in Spanish, and there's also the opportunity for 59 other languages, including sign language, Braille, and large print. And Deborah, could you give us an update on where we're at for Durham? Well, actually, yeah.
Thank you, Chair Jacobs. I'm happy to say we are coming up a bit. We are almost at 50% now. So just keep pushing that message out for us. And people, since you're home, let's go ahead and fill out our census forms online and on your phone. It's easy.
Thank you, Deborah. And our goal is 82%, right?
82%, but that's just
okay.
a floor. We can do better than that.
Right, and nobody can use the excuse that they don't have time, that they're not at home. So, I mean, some of us are working hard and out of the house, our frontline workers, but a lot of us are at home. So let's get that done. Okay, thank you, Deborah. I'm just lost my place on my computer here. Okay, so Emergency Operations Center, the heartbeat for COVID-19 in Durham. We want to recognize our incredible EOC, who has been working around the clock, night and day, leading the way and saving lives in Durham County. And you can find out more about everything that our incredible EOC staff has been doing by going to our public health website, www.dcopublichealth.org. There's lots of great information on there, and I just also want everyone to know that there's a fantastic data hub that was just launched, and it has all kinds of graphs and information and resources, and it's just a great resource. So, and the information is updated every day. So everyone, please check that out. Charter offers free Wi-Fi for eligible students. So there's free Spectrum broadband and Wi-Fi access for 60 days to households with K through 12 or college students who do not have access. Please call 1-844-488-8395, and we know this is a great need in our community with so many students having to do their classes online. Daily Dose of Parenting Wisdom for Welcome Baby. Cooperative Extension's Welcome Baby Early Childhood Program has started a live chat with parenting experts every day in Spanish and English at 11 a.m. In Spanish and 7 p.m. in English, and interested parents can visit the Facebook page for Welcome Baby Durham, www.facebook.com/WelcomeBabyDurham. So parents, please take advantage of this. Durham Pre-K is now accepting online applications for the 2020-21 school year. Please go to www.durhamprek.org to apply. And for funding opportunities related to unemployment assistance, there are some grants out there for independent contractors and the self-employed sales force care small business grants, up $10,000 grants, up to $10,000. The application is due May 1st, 11:59 p.m., so please check that out. Also, the Duke Durham Fund, Phase 1, $1 million for emergency relief is open right now. There are $5,000 grants. There's actually also another fund that's open now for up to $75,000 grants for nonprofits. And those are due, let's see, it looks like that if you receive funding in April, you can reapply. Right now, there's another round for May, and then another round in June. So again, information at www.community.duke.edu/give, and we'll have this on our website. There's new pandemic unemployment assistance for independent contractors and self-employed workers who are out of work because of COVID-19. The applications are open now. This is a federal relief program, and so please check out that as well. I want to mention also we need to make sure it's up there. I'm pretty sure it is, but the Durham Feast, which is for families who are Durham Public School families, can receive food twice a week. We want to make sure everyone knows about that. And also we'll get information up about, there's a number of surveys happening right now for up to give input for our transit plans, Durham County Transit Plan, Go Triangle, Go Durham. So we want folks to know about those. Any other announcements of important information for our community?
Madam Chair.
There's echo. You might need to mute one of your devices. Okay, great.
I'd like. I don't know what's going on.
Can you mute your iPad or your computer? That would probably take care of it.
Okay, I can close the iPad.
Okay, then you're. Yes, that's good.
Okay, thank you, Madam Chair. I'd like to make an announcement. Particularly for our community today, our attention has been totally on the pandemic and making sure that people are healthy and whole and stay alive. So there are some things that it may seem that we've forgotten, but we have not. And I want the community to know regarding the investigation, it has not been forgotten. It is just not been the thing that has been in uppermost of our minds, just trying to take care of the community. And, when we talk about the things that we need to do around that, we have a code of ethics. And on our code of ethics, for appointed and elected officials was revised in 2010, Section 3, Standards of Conduct. Item B states, county commissioners shall demonstrate the highest standards of personal integrity, truthfulness, honesty, and fortitude in all their public activities in order to inspire public confidence and trust in county government. As county commissioners, each of us has a responsibility to uphold our commitment to our code of ethics and avoid any appearance of impropriety. In my email communication to the board last week, I emphasized my continued concern and the need to revisit the handling of the investigation regarding the county manager's serious allegations regarding one of our commissioners and the history of disparate treatment of employees of color. In how we must proceed to ensure fairness and transparency as we follow the rules and the policies. To the Durham community, your voices matter. It is your right to be informed, to ask questions, and receive answers, so it is important to get updates and get them as soon as possible. This board served you, and it is appropriate to expect transparency from your elected officials. I'm asking that you please continue to hold us accountable as we work together to make our Durham a place where everyone thrives. Because this is an important issue, but we cannot put it in front of this pandemic. Because we've got to keep people alive and whole and get people back to work. Thank you, Madam Chair.
Thank you. So back to the other announcements. Any other commissioners want to add any announcements related to resources to our community during the pandemic? So, okay. Well, anyway, there are just, again, I want to encourage people to go to the public health website because there is a lot of information there. And just to address the comments that Commissioner Howerton just made, we are implementing what our board has already voted on as our steps forward. The county attorney and our clerk will be interviewing prospective independent counsel to conduct 2 investigations. One investigation will be the letter that was sent by the county manager. The second investigation will be into the actions that the county manager took in the way that he sent the letter and related to ICMA Code of Ethics and one of the North Carolina General Statutes relating to conduct of a professional executive and about whether there are possible violations of interference with elections. Those are 2 investigations that will be conducted. So I will move on to the minutes. We have the March, we're moving on to the minutes. Commissioner Howerton, excuse me.
I just have a quick question for you. You mentioned 2 issues that you had not informed me about. One of those issues you have not informed me of. That would you...
Okay, Commissioner Howerton, if you would like to have a closed session on this, we can. And I would like the county attorney to weigh in on this. We can schedule a closed session for our Monday work session. But at this point, it is really improper for you, and you brought up the Code of Ethics, to be raising this issue in the manner that you are. So I'm going to ask you to please stop discussing this right now, the nature of and excuse me. And we can have a closed session on Monday, and I'm going to move on to the minutes now. So we have before us...
Don't throw out stuff that you haven't discussed with me. That's all
Excuse
I'm
me,
asking.
Commissioner Howerton, what did you just do in the announcements? Okay? You are, again, I'm going to continue because you are being hypocritical in the comment that you just made. And I'm going to move on. Yes, I'm moving on to the March. Excuse me. Excuse me. Let's talk about impropriety. I'm going to move on to the minutes for the March 9th, 2020 regular session and the March 9th, 2020 special session meeting.
Okay, you get to call names. Go ahead.
I move to minutes.
Excuse me?
Second.
Okay, moved by Commissioner Carter, seconded by Commissioner Reckow. All those in favor, please say aye.
Aye.
And I've seen some updated guidance. Well, do we need to vote by each person at a time? Because I did see NCACC had put out some guidance that we need to, they recommend that we vote by roll call. Do we need to do that, Lowell?
Lo, are you on the line?
Can you hear me?
Okay. Oh, yeah, now we can hear you. Yeah, do you
Yeah, no,
recommend that we actually vote by roll call, because I had seen some
yes,
guidance?
No, yes, I absolutely do think it's better by roll call, so that everyone will know clearly, especially for the clerk, who is voting for or against. So yes,
Okay.
please do it by roll call.
Okay, that sounds great. Okay, thank you. Okay, so I will just vote by roll call, and let's see, I'll start with, I'll go down the line. Okay, Commissioner Carter, I'll go by seating. Commissioner Carter,
I approve.
Commissioner Hill,
Approve.
Commissioner Reckow,
Yes.
Commissioner Howerton,
Yes.
and for me, I approve as well. Okay. Okay, so next we have, it's a ceremonial item, but it's also something that our board needs to approve. And Derek Bowens, I think Derek is with us, but Derek, I have been in touch with Derek and Phil Lehman, who is the chair of the Board of Elections, and they have passed a resolution, very important, supporting recommendations of the State Board of Elections. So I had asked if it would really be helpful if we also were supportive of this issue. And Derek, I'm going to let you give us some background about this and why this is so important, if you're here.
Yes, thanks, Madam Chair. I also
Great.
have our board chair, Philip Lehman, on the line, and I will defer to him as well.
Thank you.
Yeah, just a quick background. So on March 26th, the executive director of the state board sent a letter to leadership of the General Assembly and the governor, making recommendations for what we feel are moderate modifications to statutes related to absentee by mail, and a few other matters. A few of those things were expanding options for absentee requests, which includes restoring the ability to email and fax request forms to the County Board of Elections, establishing an online request portal so that folks could make requests online, and not have to deal with the issue of printing and mailing to kind of mitigate contact. Reduce and or eliminate the witness requirement for absentee by mail, pay for outgoing and incoming postage, and also giving counties flexibility in response, flexibility in early voting hours in response to COVID-19. So those are just a few of the things in the letter, the major points that we're hoping the General Assembly will pass. It's expected that we could see a 40% increase in absentee by mail. For us, that's almost 9,000 by mail ballots, which is a huge increase. So we're hoping these changes will be made. The CARES Act allocated $10.9 million to North Carolina for elections administration. One of the other things that the executive director is requesting is that the legislature meet their match requirement of 20%, which is a little bit over $2 million, so that we have access to those funds for PPE, social distancing tools, signature verification software, for an example, if we had an online request portal option. So they're really good recommendations for elections administration, also for our voters who desire not to present in person. And I'll ask Chairman Lehman if he'd like to add a few words as a signatory to the resolution.
Thank you, Derek. No, that covers it well. The key is to make it as easy as possible to request and submit an absentee by mail ballot. There are too many barriers right now, and we believe that it can be made a lot more simple. And this is a resolution of the unanimous of the Durham County Board of Elections, which is bipartisan, and we are encouraging other boards of elections and hopefully other county commissions to do the same thing, because this requires a legislative change, and we hope that it will be and should be bipartisan to make these changes to make our election safe and accessible to as many people as possible. Thanks.
Well, thank you, Phil and Derek. This is so, so important, and I really appreciate that you all are really taking the lead on this, and I just wanted to give other commissioners a chance. I guess we could first read the resolution, and then if folks, or I guess I'll just first ask if anybody has some follow-up questions before we actually read the resolution. Any commissioner want to ask questions about this issue? Okay, and do I have a volunteer of somebody to read the resolution? Anybody else would like to read it? Okay. All right. Resolution supporting the recommendations of the Executive Director of the State Board of Elections related to voting and COVID-19, whereas thanks to earlier action taken by the Durham Board of Elections, the Durham County Board of Commissioners are fully aware of concerns regarding voting in the upcoming 2020 general election in light of the ongoing COVID-19 pandemic. And whereas our nation, state, and local communities have been mostly shut down in an effort to flatten the curve of increasing cases of COVID-19, and without the availability of a vaccine to treat the pandemic in the near term, it is unknown just how citizens will be able to safely participate in November elections. And whereas the Board of County Commissioners are aware of mitigation efforts introduced by the Centers for Disease Control and the Governor of North Carolina to curb the spread of COVID-19, including but not limited to social distancing, and whereas now is the time to create and implement alternative methods of voting to empower participation rather than to discourage voters from exercising their right to vote, and whereas the Executive Director of the State Board of Elections is in concert with the Task Force of Election Officials in the state of North Carolina, has shared substantive legislative recommendations to the General Assembly, the goal of which is to create and/or modify laws to ensure alternative and safe voting options are made available in advance of the 2020 general election. And whereas the Durham Board of County Commissioners are supportive of collaborative efforts to mitigate the impact of COVID-19 on the voting process, and will support our Durham Board of Elections as it works to ensure all elections are administered in a safe and secure manner. Now, therefore, be it resolved that the Durham Board of County Commissioners enthusiastically supports the legislative recommendations recently submitted by the Executive Director of the State Board of Elections to the General Assembly, implementing these changes as a result of the COVID-19 pandemic will be crucial to ensuring that the 2020 election in North Carolina and Durham County is successful. Be it therefore resolved that we ask the Executive Director of the North Carolina Association of County Commissioners to invite all counties to join this effort by developing similar resolutions and sharing with their General Assembly delegations, and that a copy of this resolution be transmitted to the General Assembly leadership. This, the 27th day of April, 2020, Wendy Jacobs, Chair, James Hill, Jr., Vice Chair, Heidi Carter, Brenda Howerton, and Ellen W. Reckow, Commissioners. And so thank you again so much for taking the lead on this, and we are, I think, proud to support this. And I guess this will be sent to NCACC, the leadership of the General Assembly, and also our delegation. Is that right, Deborah? And are there any other suggestions?
Yes, all of those will receive this.
Okay, great. And if we could also make sure that our Durham County Board of Elections gets a copy too, so that they know that we have done this. And Monica, can we use electronic signatures for this?
Yes, ma'am. I will add those signatures and get it out to Deborah.
Okay, great. Okay, anything else that we should know, Derek and Phil? Will you keep us posted on this important issue?
Yes, we will definitely keep you posted as things progress, if and when they progress.
Okay. All right. Thank you
Um,
again so much.
could I
Uh,
have
yes,
one
absolutely.
question, Madam Chair.
Yes. Go
Do
ahead.
we have an estimate of what it would cost to, if we went entirely absentee in an election? And paid all the return postage?
If we, well, yes, if we had the legislative change in place to do something like that, it could certainly cost upwards of $250,000 to implement a plan such as that, to mail it outgoing and then pay for the return mail. There will be additional costs on top of that base figure, additional equipment, staffing, probably software implementations for signature verifications, which a lot of that stuff would be covered by the CARES Act funding. But currently that is not in the plans, but it certainly, if there was a legislative change allowing for it, it could certainly be done with a sizable allocation
Yeah.
of those efforts.
Well, I was just curious because if we had a real surge in the fall that was, very bad, and how much lead time do you need if you had to implement something like that?
It's definitely not something that really should be implemented same year for states that have, such as Washington and other states or localities that have implemented it. Is it's something that occurs over time because it's a very huge operation. You need a lot of high-speed tabulators. You need a lot of people, and you got to train those people, and you've got to get that equipment. So it is a kind of a progressive process. So that's why the executive director did not include that as a recommendation because it is logistically very difficult to do in the time frame before the general election.
Well, the voters in Michigan voted the Tuesday after us, so it would have been, the 10th of March? And there's some linkage to the fact that when they look at they went from almost no cases to a real jump, and it was somewhat after that, sometime a certain amount of time after that election, but some linkages have been made to the fact that people went out to vote in big numbers, and in places like Detroit, there were lines and people were close together. I mean, we'd have to clearly be setting up for major social distancing, but I hate the idea that people are risking getting a virus coming out to vote. So things need to be done in a very planful manner, depending on where we are next fall.
Well, absolutely, and that is our number one priority right now, and that definitely starts with getting some legislative changes. We are, I am on the COVID task force with the State Board of Elections, and we are working on plans for mitigation for in-person voting, such as social distancing, PPE, shields. Even, it was even brought up giving a mask to every voter that comes in person if they present. South Korea, they did temperature checks for every voter in their recent election. So we are working with the state board to really try to come up with the best plans to mitigate risk for in-person voting. But at the same time, if we get these legislative changes in place, making a request for an absentee ballot, especially through an online portal, would be easy for those that obviously have computer and internet access, and it would be easy for administrators because that data will automatically flow into our systems, and we won't have the data entry component to worry about and slow down absentee at times. So I totally understand the concern, and we are working very hard to make sure we have everything in place for a safe election in November.
Okay, thank you.
Thank you. Great questions, Commissioner Reckow. And, when we think about who volunteers or who works at our precincts, it's a lot of retired people and, a lot of people who vote we see with the last election, right, Derek, thanks to your great graphics that a lot of our voters are older people, and that we know this is our at-risk population. So it's even more important. Any other commissioners want to comment on this issue or have questions? Okay, well, again, thank you so much, Phil and Derek, for your leadership on this, and we will follow up on getting that out. So next we have our consent agenda, and since we have never seen any of these items before, again, I think we'll just let Mr. Manager, if you could just take us through each item. Well, I mean, the first one is a resolution, actually, that for our board to consider. But if you could just walk us through each one, since we haven't looked at these during a work session or anything. Thank you.
Can everyone hear me?
Yes.
Can everyone hear me?
Yes.
So, item 148, as you indicated, is a resolution of support for the Eno River water supply. And essentially, the board is basically being requested to adopt this resolution for reclassifying a segment of the Eno River and the water supply. Any questions? Hearing none, we will go on to item number 149, which is essentially a request to approve the expenditure increase of $39,000 for the purchase of ebooks, audiobooks, and streaming video from Overdrive for fiscal years 2020. Are there any questions regarding that particular item?
Mr. Manager, I would be curious to know how many additional ebooks, for example, will be able to be purchased for this amount. I have heard complaints that because everyone is hunkered down in their homes, the use of ebooks has gone through the roof, and as a result, most of the popular and even moderately popular books are not available. So I'd just be curious what kind of infusion of additional books will we experience.
So I'm going to ask Tammy to address that issue. I'm pretty sure she's on the line. Tammy Daggett, our library director.
Yes, I am on the line. I do not have those statistics in front of me at this time, but the numbers are increasing, and us adding additional ebooks allows the whole list to be shorter, and all of our numbers related to e-audio, ebooks, all of that are definitely increasing during this time. It's a way for the customers to continue to be able to read and to read freely, and the $39,000 that we're speaking of is with existing funds. It's not additional dollars that we're requesting. I can get those numbers emailed to you after the meeting.
Okay. Well, let's do this, Tammy. I'd be interested in you looking, at where things are prior, and then what we accomplished with this additional money, so we can gauge how, if there's 10-week lag or 12-week lag for certain books, how many weeks does that shave off? It'd be interesting to know. So maybe we can look at whether we can do some rejiggering in next year to help if we feel like we're going to need it again next year because of the conditions.
Okay, thank you.
All right. Are there any other questions regarding item 149? Hearing none, we will move to 152, which is the contract amendment for Nighthawk Security Services. And this is additional services that are needed as a result COVID-19. Are there other questions regarding that particular item, 152?
I have just a high-level question. We approved the funding for this at our last meeting, correct? And this is not additional funding, this is just now amending the contract?
This is Susan, and that's correct, Commissioner. What we had to amend the contract to include the required FEMA language. So
Okay.
that's what this is doing, is including that required language.
Okay, very good, thank you.
This is Wendy. I had some questions related to this. The information that was provided to us, I didn't see anything about the actual savings in libraries. There was a chart that listed a lot of different county buildings and where we were saving, but I didn't see anything about the libraries on that chart in the agenda.
Commissioners, this is Matrio. With regards to the libraries, the resources that have been in the libraries have been reallocated to the posts that are required by COVID-19. And so the only post in the libraries that we are presently maintaining is in the main library, as well as the fact that we do have a tour guide that goes out during the day and in the evenings with regards to checking and certifying that the libraries are in good condition. But all of the resources that were at the libraries have been reallocated so that the true cost of the resources that have been used for COVID is over $100,000. But we've reallocated resources using the present budget.
Okay, so I guess I expected the chart to also show where the savings was. So what is the total that is being saved at the libraries and being reallocated?
It's over $100,000.
Okay. Well, if you could, I guess it would be good to just understand exactly which buildings that's coming from. And I was curious why we're paying for, one of the things it mentions is the Duke stockpile. And I was just wondering, why is that a county, the Duke Health Warehouse for the Strategic National Stockpile? Why is that responsibility ours rather than Duke's?
It's because it's an EOC stockpile. It's where they will actually stockpile products that come in, or PPEs, etc. It's for the EOC. The EOC has actually generated that facility. It happens to be on Duke property, but that is the facility that they're using for warehousing.
Okay. And then what percentage of this will be reimbursable by FEMA? Or what is the estimate? Do we know?
It's a consistent 75%.
Okay. And then I was curious, in the description it mentions that we have our tent outside of the Health and Human Services building, the screening tent. Do we have that similar setup outside of the courthouse?
No. The courthouse has a serpentine inside of the facility that allows the customers to actually be able to go inside and we also have a cover, if you notice, for the courthouse that extends beyond the front door, so that there's sufficient serpentine through that area for them to be tested.
Okay. And are the same protocols, I know, that the EOC developed for screening, are they happening at the same ones are happening outside the courthouse?
Yes, they're doing temperature checks as well. as they're doing at the HHS building.
Okay. Okay, thank you.
And if I could, this is Tammy speaking again. If I could go back to speak about overdrive, I was able to get some additional information from staff that have been working on this. The $39,000 of reallocated funds would provide us with 780 additional copies. And we are expecting the lead time with this being moved forward with purchasing as soon as possible, that it would be within 1 to 2 weeks.
Right, thank you,
Okay.
Tammy.
Thank you.
You're welcome.
Okay, are there any other questions regarding that particular item? Hearing none, we will move to item 153, which is the contract amendment for increased janitorial services that is resulted as a result of COVID-19. Any questions? Hearing none,
I'm sorry, I do have some questions, Wendell. Just waiting for other people to get a chance first. I was wondering what is currently the what's happening out in terms of the courthouse cleaning. I guess when I think of the most used facilities right now, it's our Health and Human Services building and the courthouse, of course, the jail as well. And and they're still having, domestic violence court and child abuse and neglect and some other courts. Mo, could you tell us, how are we actually managing that in between courts and people, using the actual courtrooms? How does that happen?
Commissioners, can you hear me?
Yes.
So with regards to the courthouse, we have 2 day porters now at the courthouse. Hello? Is everybody there?
Yes.
Commissioners, can you hear me? Okay.
Yes.
Okay. So we have 2 day porters at the courthouse. The courthouse has scaled down many of their cases, and so at the courthouse we definitely clean between sessions. If there's a request from a judge to have an area cleaned, we immediately respond to that through our day porters that are there. In the evening, we have a team of 4 to 6 janitors that come and clean the entire building every night and sanitize the building every evening. With regards to the HHS building, there is a day porter in every quadrant of the building, so that means that there are 4 day porters to wipe down consistently through the day, and at night there's a total of about 12 people that come in and clean the entire building. We've also had some dedicated services to the EOC because they are there 7 days a week. And so we have day porters come in and manage that facility on the weekends.
Okay, thank you. Obviously, it's really important. Both of those buildings, the admin too, and Health and Human Services and the courthouse. Mm-hmm. And on the chart, the different libraries are listed, but when it says new contract total, the money is not actually for those libraries.
No, the money with regards to the janitorial, the monies that are identified is for the COVID, the extra work that was asked. Now, initially, the libraries were initially open, and we were asked to provide additional cleaning for those libraries while they were open when COVID first started. And so there is some cost with regards to the libraries for janitorial services. We also, when the library closed, we also asked all the janitors to go in and sanitize the library upon their closure. So that when the libraries reopened, they would reopen to a clean and sanitized facility.
Okay, so that's why they're still listed on the chart.
Yes, yes.
Okay, got it. Okay, thank you.
Are there any other questions regarding item 153? Hearing none, Madam Chairman, that concludes the consent agenda.
Okay, thank you. And so we have before us the approval of the consent agenda, items 20-0148. Phone keeps doing that. And through 20-0153. And I would entertain a motion to approve and a second.
So moved.
Second.
Okay, moved by Commissioner Carter, and I'm not sure who the second was.
I think
I
Ellen
made
moved.
the mo-
Yeah,
I made
I'll
the
second
motion.
Oh, okay, moved by Commissioner Reckow, seconded by Commissioner Carter, and then we will take a roll vote, starting with Commissioner Howerton,
Yes.
Commissioner Reckow,
Yes.
Commissioner Hill,
Yes.
Commissioner Carter,
Yes.
and me, yes. Okay, great. All right, now we move on to discussion of face coverings for high-risk Durham County residents, and I want to thank Commissioner Howerton for taking the lead on this very, very important issue and project, and appreciate her working on this and bringing a proposal back for us to consider. And I will turn this over to you, Commissioner Howerton.
Thank you, Madam Chair. This is a conversation that I'm sure all of you know about, that we want to make sure that our citizens, as I said before, that we do everything we can for their safety. And I received an email from one of the doctors that was working on this already, by way of our chair, Wendy, look at his proposal, what he's doing, what else is going on in the community, where are we not providing face coverings for people. So I asked Dr. Isaac if he would be on the phone tonight, questions that the commissioners may have. One of the things that we were looking at was what is the cost? What is the cost to have every citizen in Durham with a face mask? I did speak with one of our city council folks as well to look at what would it cost for us to do that. And since that time, had a conversation with Durham and with Progress Energy, and she's already delivered face masks to Lincoln, face coverings to Lincoln, so Lincoln is taken care of already. So if I'd like to hear from Dr. Isaac, covering the Triangle is the name of the organization. So are you on the phone?
Yes, I am, and thank you, Commissioner Howerton, for inviting us into this. Dr. Larry Greenblatt is also on the line. I should clarify, I'm not actually a doctor, I'm an organizer of this project, but Dr. Larry Greenblatt can answer the medical question.
I just moved you up and called you doctor.
Well, I appreciate it.
Okay.
So what was the first question that you wanted to answer?
Do you want to share with us what you are doing and what you see the projected earnings, if you've done any analysis around that?
Great. So we started a few weeks ago with the objective of getting face coverings to the highest risk and most underserved populations of the county and the border area. So that was unsheltered people, incarcerated people, bus drivers, essential workers, and people like that, people in nursing homes. And with the idea that if we all wear face coverings, we all keep our community safe. And I really appreciate that the board recognizes the significance of this issue. To date, we have distributed over 25,000 face coverings, not all in Durham County, but the vast majority within Durham County. And we have distributed to Lincoln, as well as many other organizations, by partnering with local community organizations and clinics and nursing facilities and communicating with leadership there. We've been able to get distribution into those places. And now we are just interested in seeing how the county can potentially take up this work and expand it beyond what we have been able to do thus far.
We all received your information that you sent out. It was very informative. Thank you. So right now, I know that you work down at the bus depot a lot. Is that where most of the area that you work?
We have been distributing face coverings all over the city. One place has been the transportation center. John Talmadge of Durham has taken a lead on that and distributed probably 2,000 or 3,000 at the bus station at this point to bus drivers and bus riders, and raising awareness through that public distribution point. We have also distributed through supermarkets, and we're looking to try and keep doing that through grocery stores, as well as urban ministries, Durham Rescue Mission. I believe that we've also handed over 1,000 or so face coverings to the county itself to distribute through public health and through the DPS Foundation. And so really our work has gone all over the city at this point, and all over the county. So the bus station is just one part of that that's kind of public facing, but we have also distributed it privately to individual organizations that have been working with those highest risk communities.
And Isaac, this is Larry. Let me add a couple of things. We're certainly partnering with a lot of nonprofits in our community who are getting to some of the targeted populations. We've given many masks to Lincoln Community Health Center, and the masks that were donated by Progress Energy to Lincoln were medical masks, not the face coverings that we're issuing, and they were only to be used by the medical providers at Lincoln. Those were N95 masks. There was only 250. Okay. Lincoln has about 40,000 individuals who come for care there, and we've probably provided about 2,000 masks to Lincoln, and I just don't want us to feel that they're done. They're far from done.
So the ones that they delivered were just the N95, which is more the medical one.
Yeah, they're high-grade medical masks, and they were donated. My wife delivered them, but they were brought to our house.
And it's important to emphasize that Covering the Triangle's efforts have primarily focused on acquiring and distributing face coverings that are not medical masks. So these are not N95s that offer that level of protection for yourself. They're primarily about community protection. So if you wear a face covering, you keep me safe, and if I wear one, I keep you safe. We all wear them, we all keep each other safe. And so targeting that at residents rather than healthcare professionals has been our focus. So we have not primarily been delivering masks, protective equipment for medical professionals. Rather, we have been delivering fabric face coverings to high-risk communities who are at risk of contracting this disease.
And there's been a lot of demand from some of the skilled nursing facilities in our community, because they are seeing both outbreaks in our community and elsewhere, and mortality rate has been very high. I understand in North Carolina, nearly half of all deaths have been in some of these congregate settings, particularly nursing facilities. And I think we could do a lot more there as well.
51%.
51, thank you.
What was that, James?
51% of the deaths in North Carolina come from nursing care facilities.
Yeah, yeah. So I had mentioned, I had talked to Jody, staff person about this as well. Jody, are you on the line? Jody?
I'm on the line, Commissioner Howerton.
So did you find out any information regarding this? As related to the areas that we have not serviced so far?
Through our Emergency Operations Center, they keep a list of those that have requested those types of masks and that we've provided them to. And so we can certainly circle back around to that list. And I know one of the things that you and I had talked about is if this is an initiative that the board wants to move forward, there would need to be a way to organize and coordinate the distribution of the masks. Right now, our volunteer capacity at the Emergency Operations Center is pretty limited with some of the other major tasks related to the homeless sheltering and the food security work. And so we would need to figure out how do we physically get the masks to those areas that most in need.
Okay. Other commissioners have questions?
Well, this is Wendy. I just again want to thank you, Commissioner Howerton, for taking the lead on this. And we had discussed, just first of all, the information from the CDC that came out on April 3rd, which was the basis for our Durham County and the city adding the requirement to wear face coverings, because we know that this is something else that can really protect people and help spread the virus. But we also know that there are inequities and disparities related to this issue, that a lot of people really don't, of course you can make a face covering out of a towel or a t-shirt or a scarf, but that we really wanted to, make sure that people who wanted to actually have a mask could. And Commissioner Howerton had sent an email really concerned about people riding the buses. That's a situation where you're in a closed space and people don't have a choice. If they don't have a car, they have to ride the bus to get around. And she had raised this issue of, trying to figure out a way, for instance, to make sure that people who are riding the buses have that available to them. And it's great to hear, that Cover the Triangle has been definitely focusing on that. And then, so I know for me, I think this is really important, that we address this, especially with our really high-risk populations. We know, again, that unfortunately this is a racial equity issue in terms of how the virus is impacting people. And so, I think we have different options that we could consider as a board. But one thing is, I think, now, Commissioner Howerton, did you follow up about what budget we could possibly use? We had discussed the fact that we still have a discretionary budget within our board. I know I haven't used my whole travel budget.
Yeah, I did. I checked with Monica, and we do have some discretionary funds in the budget that could be used. And as I said, I had checked with the city as well. One of the city council folks had mentioned that maybe we could do whatever we did that they could match if the board chose to do that. And I guess the question that I would have would be, I guess we'd have to look at how many can we provide and the cost. And what area. Because one of the things that we don't want to do is pick one area over another. So how do we manage that? How do we manage serving one area and not another?
Commissioner Howerton, one thing we could do is, I think I heard on NPR that about maybe 4 or 5 days ago that the city of Winston-Salem is providing maps to anyone in the city who needs one. So it might be worthwhile to contact Winston-Salem and see what they're doing there in terms of distribution, and the concept of focusing maybe within the city limits, and if the city would match our efforts, and we might be able to make a decent dent. It would just be interesting to see how they're doing it, what their distribution system's like.
Okay. Well, I think that the time is of the essence as to whether we do it or not. And I think that's what I heard from the folks with the triangle.
Right. Well, given the distribution that's occurred to date, do we have any estimate of the gap from some sense of how many thousand we're talking about in terms of the gap?
So this is Larry Greenblatt. I think we need to think about potentially prioritizing. I think we have hundreds of thousands of people in the county. Really, everyone could use a face covering. Some people are going to be higher risk than others. Some in terms of high risk for acquiring the virus. Others at high risk if they were to get it. They're at high risk for hospitalization or from dying from it. And I think at some point we're going to have to draw the line. Unless there's a very large amount of money, we won't be able to get as many masks in place as we want, or as many face coverings, I should say. Some of them are more durable than others, we believe, though we're not sure. And so we might need to also think about, if this goes on for months and months, how do we replace those that are lost or ones that are torn or whatever? And I think there needs to be some strategy around this. I think the masks that they're using in Winston-Salem probably costs in the range of $4 or $5 each, and you can buy them internationally. Isaac has a source. We haven't seen their product or worked with them, but they're in the range of $1 each. They're made overseas, mass produced, and it might make sense to step back and say, well, do we want to try to cover more people with low cost masks? You could buy 50,000 of them for $50,000, as opposed to a $5 mask, you can only cover 10,000 faces. So these are some of the questions that need to be thought through, and then see how much money can the city and the county come up with together to do this. I think it's a tricky thing. We can't do everything.
Right. Yeah, I think you're right. I think it's really for us to really hone in on what is it that we are committed to doing.
Right. So what is the amount left? Do we know how much?
Many of the masks we distributed are not going to last long enough. So we gave, for example, 2,000 masks to migrant farm workers. Those are going to last a couple of weeks or so. We were anticipating the peak. But, it looks like this is going to be a long haul and not a short haul. For example, we gave, to the homeless shelters, the people in those programs change, and then plus masks will be lost, masks will be torn or worn out, and they're going to need replacement. So it's hard to put a number on. Okay, this many are done. Maybe we've given out. What would you say, Isaac? Maybe 6,000 or 8,000 of the cloth masks, and the rest have been largely ones that we sourced from the original mattress factory, which are good quality, but they're made out of polypropylene. They're stitched together quickly, and I think my sense is they might last 2 weeks or so. You want to weigh in on that, Isaac?
Yeah, that's right. And I think that, we can certainly provide a list of all of the organizations and with the numbers that we have distributed through those organizations to the county. In fact, I already emailed that list to EOC, to Ari Shine. And really, it's hard for us to say because we also don't know, we don't have the information perhaps the county has in terms of that view of how many people are in specific risk categories. And I think that would be the consideration to have is, how many people in Durham are at risk of serious illness due to an underlying chronic health problem such as diabetes. Where are those neighborhoods? And that data is found on the Compass North Carolina Data Works website, for example. But I think that's the kind of questions that we need to answer in order to figure out the numbers.
Mm-hmm. So, Isaac, you've got, I'm looking at your information here. You've got cost, face coverings, $1 each. And then I look at the hand sewn face coverings of $5. And then I see another one from international supplier is $1. So those all different rates that you have used before?
So we have used the first two, i.e. the original mattress factory and the hand sewn. We have not used the international supplier. I just developed a lead on that with a view to much larger purchases if we needed to get them. Up to now, we haven't had the resources to put an order in with an international supplier, but I was developing that as an option. So we haven't made the order yet. I have seen a sample and it looks perfectly good and it feels perfectly good. But I haven't made an order, so I can't testify to whether they're going to deliver on time or, questions like this.
Okay. If there are any other questions from the board?
Yes, I have a question, please. I'm wondering, this is a fantastic mission Cover the Triangle has, and really thank you for the work you've already done. I'm unclear as to whether you all have continued capacity to and a system in place to distribute the masks, and it's just a matter of needing additional funding, or everything needs to be figured out.
Isaac, I'm going to address that. So we have raised funds through a GoFundMe site. So I would say a good portion of the total expense has been borne by Dr. Westman, who's not on the call tonight, out of his own personal savings. My wife and I have donated very generously, but not nearly what Eric contributed. And we've basically vastly overspent the amount of money that we've raised. And Dr. Westman and I both have jobs, and we can't keep going like this. It's been long days, weekends, nights, working on this. And I think we need to develop a plan where the government steps in. And that's what we're asking for tonight.
Thank you. That's very helpful. I just don't think we can come up with a plan tonight. We need I don't know, a group of a subcommittee or the administration needs to come back with a proposal for us if this is something we want to do. I just hate to try to develop a plan on the fly tonight.
I agree. It's complex, and I just want to also offer that Dr. Westman, Isaac, and I would be more than happy to help develop that plan and help think through it. And it should be done thoughtfully and carefully, and not in a meeting like this on the fly. That you wouldn't.
And I
hard to do it. Wow.
I absolutely concur with you. Tonight was basically to have the board be knowledgeable about what it is, if they have any questions, have you be able to explain what it is that you have been doing already and what you see that's needed, and then the board or a subcommittee can come together along with you and come up with a plan and have our staff participate with that. I appreciate you coming online tonight and sharing this information with us. Was there somebody else wanted to say something?
Well, I just wonder if we could get from the clerk how much of our travel money is unexpended for this fiscal year, you know?
Commissioner Raquel,
Well,
I do not have those numbers right in front of me. We did just get access to our shared drive. I did speak with Chair Jacobs, letting her know that I would have that information to the board this week.
Yeah, we looked at a small amount to begin with that I was asking Monica about if that was in the budget, and she said yes. And I had not explored it any further than that because I felt like we needed more information.
Right.
And I think we could work on that offline.
But I mean, what would be good to know, because we are in a fiscal crunch, but we do have some money that is unspent because of the circumstances this year. People didn't travel as much, so we may have $15,000 or $20,000 that we know we could put in, and then we could see whether the city has a similar situation. So what I'm just thinking is, at least for the upcoming couple of months, how much can we allocate? Because it would give us a sense of, in the short term, what we could finance.
Well, why don't we do that? Get with Keith and Monica and the manager and see what we come up with, and then we could get back in touch with folks or begin to come up with a strategy of how would we manage this.
Mm-hmm.
So this is Wendy. Could we get one other commissioner to work with Commissioner Howerton and have a committee? I don't want to put too much of it on the staff. I think we heard from the EOC that they are really busy with other things, and I just want to be sensitive that we're not putting another thing on their plates. I was hoping that our board, we could take the lead on this with Commissioner Howerton leading this, but if one other commissioner could work with her and be a committee and a consult with Isaac and Dr. Greenblatt, and of course consult with EOC staff and Rod Jenkins about it, but I don't want to create a lot of extra work for them as well. I want to be sensitive to that. So would anyone volunteer to help Commissioner Howerton on this?
I can help a little bit. I'll be happy to.
Okay, great. And I think that Keith, maybe you can confirm this, that we have $28,000 left in our discretionary budget through June 30th.
This is Claudia. That is correct. You have $28,000 left. She had looked that up earlier. She was on the call, but may have gotten disconnected.
Okay, thank you. Okay, great.
Okay. Thank you both so much, Larry and Isaac. Thank you so much for being here tonight and sharing this with us, and we'll be back in touch.
Thank you, Commissioner, and thank you for your leadership especially.
Thank you very much, Commissioner.
Okay, great. And next item on the agenda is Durham County update on the COVID-19 crisis. And I guess related to this issue, our work session is on Monday, so we could get an update on the face covering issue. We could have that on our agenda as well, just to get an update from you all. So then I'll turn it over to Rodney Jenkins, Jim Groves, Leslie O'Connor, Jody Miller, Joanne Pierce, the county manager, whoever wants to start off on this item.
This is Jim Groves. I'm with you. I'll go ahead and speak up and just share that, from a strategic EOC perspective, the entire function there right now is to make sure that the interfaces and the relationships with anyone that can bring resources to bear to support what's going on in Durham County, that's exactly what their focus is. So trying to leverage where we can find personal protective equipment, mask, gowns, gloves, sanitizer, but also have a plan in place that, if this thing continues down the road, that we've got staffing and people to be able to do that. And just want to share again, like we did last meeting, Rod and the public health staff have done an amazing job and showing up every single day. Leslie and her emergency management team, continue to manage and run the Emergency Operations Center with support from the fire marshal staff doing the logistics function, and also EMS staff that is stepping in and doing the planning or the forward planning or incident action planning function. And all of this is going on while we continue to do our day-to-day jobs, right? So fire marshal still continues to do inspections and investigations, and EMS still continues to run call. And I really appreciate your comments about, not trying to keep the additional burden off of the EOC. So we think, it's a fantastic concept. We're hoping there are other volunteer organizations that might be able to come to bear with that. But really, really proud of their work and an incredible team effort. Drew Cummings there with the manager's office. Jody and Wendell are always there to provide support when we need it. So it's a fantastic operation, and I think we're pushing our 50th day of continuous EOC activation, which is a first in Durham County's history. Rod.
Thank you, Jim, and I echo your comments. I hope everyone can hear me. Public health continues to be thankful and grateful to the Board of County Commissioners, county management, of course, emergency management, our new brothers and sisters in arms, for all of its support. And we are so thankful for our partnership in this COVID-19 response. Additionally, public health continues to support the unified stay-at-home order and its subsequent amendments by both the county and city of Durham. It's been a pleasure to work with the chair and the mayor as we continue to stay the course and do our best to protect and promote the health and welfare of the citizens of Durham. By bringing your current numbers as of 7 o'clock p.m., globally, there have been 2,883,603 positive cases of COVID, resulting in 198,842 deaths. And again, it's in 213 countries, areas, and territories. As far as within the United States, per the CDC, there's been 957,875 positive cases of COVID, resulting in 53,922 deaths, and that's in all 50 states and 5 U.S. jurisdictions. In the state of North Carolina, there's been 9,142 cases of COVID, positive cases of COVID, resulting in 306 deaths, and it's now in 95 counties. And in Durham County, there's been 565 positive cases of COVID, resulting in 16 deaths. The average age of individual with COVID in Durham is 49 years of age as of today. We have 2% of our cases under the age of 18, 44% from the age 18 to 44 years old. 32% of our cases are 45 to 64 years of age, and over 65 years of age represents 22% of our cases. In terms of close contact, we have about 347 cases, or 63%, that were the result of close contact. Our community spread continues to go down. We have 92 cases of community spread, representing 17% of our cases. 109 cases were travel related, representing 20%. And we have about 4 cases that are currently under investigation, representing 1%. As mentioned earlier, a lot of our cases are a result of long-term care facilities, that's representing 33%. Total cases that are healthcare workers or individuals who work at a healthcare facility represents 22%. We have 30 individuals who are currently hospitalized. And to get a little bit more specific, of the 16 deaths, 14 are a result of those individuals who are at long-term care facilities. A closer glance at our long-term care facility outbreaks, if you will. There are 47 positive cases at Trayburn, 111 positive cases at Durham Rehab, still 4 cases at Durham VA. We have 5 cases at Durham Recovery and Response Center, and we have 2 cases at Hillcrest. As far as race and ethnicity, 3% of our cases are Asian, 33% of our cases are Black or African American, 6% are categorized as other, 12% are categorized as white, and 46% are categorized as unknown. A few public information updates for you all. We did publish the new data dashboard as indicated by the chair, and it is linked to the public health website, and it's been shared on social media. And since launching this past weekend, we have had over 33,000 views. The website called the Durham County Coronavirus Data Hub provides a wealth of information as been requested for several weeks now. Total confirmed cases, average age, total long-term care facility hospitalization, all that information is out there. I think most impressive is the COVID-19 Durham County demographics that has just about anything you can think of to include population, total employees, total businesses, you name it is out there. We also provided information by zip code. So we have cases by zip code. We also have cases per 1,000 persons for a little deep dive into geographic area. And then we have some additional graphs out there for your viewing pleasure and for your ability to understand what's going on in Durham County. There has been a number of radio ads. I am committed to doing whatever I can to spread the word about COVID, be it television interviews, be it radio ads, be it voice recordings. So those ads continue to be received well on the local radio stations, to include K97.5, 103.9, and 107.4. They're also streamed live on social media, and they are recorded and played approximately 150 times over a 2-week period. Again, we do weekly updates in the form of a video, specifically targeting various topics from cloth masks to social distancing to sheltering and staying at home orders and changes to them. We just want to make sure that our residents have all the information that they need. Additionally, we are participating in weekly Latinx community calls to better understand the Spanish-speaking community communications needs, and that's continued to go well. In terms of the big 3 in which the governor is utilizing to analyze how we're doing, that includes testing, that includes contact tracing or tracing, it also includes trending. What are we doing in Durham? Duke University has indicated to us as of today that they have the capacity to test around 700 individuals per day. Currently, they have that capacity, but they're actually testing right at about 560. Per the state of North Carolina, Durham should be testing about 539 individuals per day. So we continue to work with Duke University Medical Center and Duke Regional in an effort to come up with an effective plan for community testing. So meetings are forthcoming with that. We have a great partnership on the horizon that I'm proud to announce today. We're partnering with Walgreens and the North Carolina Department of Health and Human Services for drive-through COVID-19 testing. Testing will be free of charge. The only thing that they're probably going to ask for is insurance information, but I've been assured that the testing is free of charge, and it's going to be able to produce approximately 160 tests per day. They will run this 7 days a week from 9 a.m. to 5 p.m., of course, weather permitting or barring any unforeseen circumstances. And they will be conducting the testing at 3798 Guest Road in Durham. It's the site of an old Rite Aid, but it's now owned by Walgreens. So we're proud to announce that, and they hope to have that come online on May the 1st, but I'm continuing to keep track with them, but they're making their final preparations. In terms of contact tracing, we've had 6 Duke students to join us today. We have 9 more that will come on board. We trained them last week, and they're off to a great start, and they're helping us to expand our capacity to contact trace. Again, we continue to have ongoing conversations with Duke about different needs that we have and ways that they can help and we can partner. The state, as it was announced today, is working with CCNC to expand the local health department's capacity to contact trace. It's been reported that 250 people will be hired statewide, and they will be under the leadership of local health departments, and they will be trained to contact trace to help us. So that's a great resource as well. And Duke's Population Health Division has come up with a contact tracing platform. We had a conference call with them last week, and we were still awaiting a decision with the state to determine how local health departments will proceed. So we're going to continue to explore that. As far as trending, we have brought on support from DataWork, which is a local nonprofit, to expand our data capacity. They were on site last week, and we're going to continue to work with them. Our ultimate objective is to create a platform that mirrors the state's information for reopening, but we want it to be specific to Durham County to indicate how we're testing, how we're trending. Are we in that 14-day window? So we look forward to publishing that. We are finalizing the MOU with Duke. Again, we want to be able to share more data for surveillance purposes. It's been approved by county legal and it's been sent back to Duke, so we should have that finalized real soon. At this time, I'm going to turn it over to Leslie O'Connell for further updates.
Thank you so much, Rod. Good evening, Chair Jacobs, Commissioners and Managers. This is Leslie O'Connor, Chief Emergency Manager for the City and County and the Incident Commander for Durham County COVID-19 response. Today marks day 41 of 7-day per week operations of our EOC activation related to COVID-19. And as Director Groves indicated, we are very quickly approaching 50 days of some type of activation when you include malware as well. To date, we've had almost 200 city, county, nonprofit, non-governmental agencies, and volunteers assist with our Emergency Operations Center. We've divided our operations section into 3 branches: Public Health, Public Safety, and Human Services. And Rod has already given you your update for Public Health. Our Public Safety branch continues to work closely with one another, holding multiple conference calls per week in order to coordinate response to the COVID-positive 911 calls. Our Human Services branch is subdivided into 3 task forces, including DSS, homelessness, and food security. DSS has issued supplemental food and nutrition services totaling $908,427 between April 22nd and 26th. Pandemic EBT waivers have been issued to provide supplemental SNAP benefits to all children enrolled in North Carolina's schools' free and reduced lunch program. And also, online shopping waivers have been issued to allow SNAP clients to use online shopping tools with approved grocery retailers. The Homelessness Task Force has housed 98 residents of Urban Ministries of Durham at the Marriott RCP Hotel. Further work is being done to ensure our coordinated entry can have new clients identified as high priority for shelter to the actual shelter as quickly as possible. We're working to secure rooms at a second hotel for 2-week quarantines of individuals released from the prison and detention center, as well as individuals testing positive for COVID who have no place to go. The Food Security Task Force is working with the Durham Public Schools Foundation in assuming the student feeding effort. The Foundation's initial plan for the Durham Feast effort was to provide food for up to 6,500 children eligible for free and reduced lunch, as well as 5,000 adults in the same household, with a primary focus of serving children. As of last week, approximately 8,300 children have been served, a significantly higher number than their original target. The number of adults they've been able to serve is lagging behind the target, in part due to uncertain funding for adult feeding, but those numbers should be increasing this week and next as well. Our logistics section continues to order and receive personal protective equipment, or PPE, both on the market and through North Carolina Emergency Management. N95 masks and surgical gowns continue to be an issue to find. To date, we've received 3,810 donated masks from Mask Now, Face Mask Warriors, Cover the Triangle, and Trosa. We've received 1,450 PPE-style masks from Duke Energy and BAPS charities. We've received 68 PPE Tyvek suits from Biogen, and we've received 5 gallons of hand sanitizer from Duke Energy. Our plan section is documenting our incident and working within the city-county recovery plan to convene committees of representative work groups to work through lifting stay-at-home orders when the appropriate time arrives. Our finance section is working to execute contracts and procure goods and services throughout the COVID response. Additionally, they've completed application for public assistance under the Robert T. Stafford Act for federal reimbursement of emergency protective measures. And it should also be noted that we've given information to multiple nonprofits to be able to apply for this same public assistance. We're so thankful to the Board of Commissioners for their support throughout the response to this pandemic. Many working the front lines have experienced the loss of loved ones due to this indiscriminate virus, and we're working tirelessly to flatten the curve and to stop the loss. I now turn this over to General Managers Miller and Pierce.
Thank you, Leslie. That concludes from the emergency management side updates that we have, and I don't know if there's any other information on the public health side that needs to be shared. If not, we are available for any questions the board may have this evening.
And this is Joanne Pierce. I don't have anything additional.
Well, this is Wendy, Jim, and Leslie, and Rob. I just want to say thank you so much for that incredible report, and I know that the rest of the board really appreciate it. I'm going to open it up for questions from board members.
So, my questions are concerning the institutional and congregate care facilities, the rehab centers, the rest homes, and our jail. People are in a very difficult situation there, and we're seeing the impact. And I guess I asked the similar question last meeting. Is there anything further that could be done to help protect these fragile people in our institutions? And then after that general question, I'd like to bore in about the jail with more specificity. But Rod, have you learned of anything further? I mean, is it correct what Commissioner Hill mentioned, that almost half of how many of the cases are attributed to long-term care? I saw a figure in the MAC notes about healthcare workers being a very sizable percentage of the cases. what are we actually seeing?
Yes, ma'am, Commissioner Reckow, thank you so much for that question. The figures that I reported in the MAC call were the number of healthcare workers at long-term care facilities that were affected by COVID, and that's at 22%.
And that's 42%.
No, ma'am, 22.
Oh, 22. Okay,
Yes, ma'am.
there was something about, well, there was a figure of 40 something, maybe it was 45%, but that was across the community, something about healthcare workers. But I don't know, we'll have to check that math. But
I'd be more than
the
happy
bottom
to get you
line
that information, but to address your other concerns, yes, the majority of our cases in Durham, of course, started off as travel-related student travel, but unlike Durham is no different than any other community. You know, I was just talking on a conference call with our neighbors in Vance and Granville counties and Orange counties, and we're all struggling with long-term care facilities and congregate living facilities. And as far as what we've done, I mean, we have held webinars, we've done on-site visits, we have formulated a long-term care facility strike team composing of a registered nurse and a registered sanitarian, and that's been working out phenomenally well. The only thing we can do, Commissioner Reckow and fellow commissioners, is provide that guidance. What I have done is take it a step further. I have been in contact with the area ombudsman for long-term care facilities and just really getting the regulatory authorities more involved, because I just realized that I really wasn't hearing anything from them, and I knew that some more dialogue was needed. So that's been proven to be effective. But the unfortunate thing is that a lot of the facilities are much older, not as modern, and they have a lot of individuals in tight spaces. So it's easy for COVID to enter those facilities and spread very quickly. We have gone on site, myself and my deputy have gone on site to view those facilities that are hardest hit, to ensure that sanitation guides are being followed, to ensure that they have their policies and procedures, to lay eyes on staff to see whether or not they're wearing the appropriate PPE. It's just a tough situation at the present, but is there anything else I can do? Now, public health does provide as much guidance as we can. We avail ourselves. We continue to call all 22 facilities and check on them just to make sure that they, see whether or not there's any staffing needs or any additional information they can require. We just stand ready to involve the state. The one other thing I will say, Commissioner Reckow, is that it's become such a nationwide issue that the CDC has gotten involved, and the new guidance does indicate that if there's an outbreak, we are to report it to the CDC directly, and the CDC directly gets involved with these long-term care facilities. So it's that big of an issue. I do apologize, I didn't hear what the final question was.
Well, that has to do with the jail, but before we leave the long-term care facilities, I would suggest one avenue might be to look at the facilities that, thank goodness, have so far stayed safe and not had cases. There's one right near where I live, Crowsfield Village, and the last I heard, because I see people out on walks who are out and about, the people who live in independent living, and they said that they implemented very strict rules and regs in early March, and it appears by being very proactive, testing employees and whatever, that they've had so far, knock on wood, good outcome. So, what we may want to do is get a compendium of the things that the facilities that have weathered this first storm well have done, and then maybe we could put out some information sheets to everyone. We might as well share good news just like we're sharing the bad news in terms of the cases and the deaths.
Yes, ma'am. Thank you for that suggestion, and I will certainly take this back to our long-term care facility strike team and just implement this as a best practice.
I mean, they just stopped all the congregate meals, all the social activities. They're all remote now. They restricted visitors early on, and they started taking temperature checks of employees back in early to mid-March. So, I mean, they just did a lot of things proactively.
Yes, ma'am.
So, yeah. Well, on the jail, obviously we got some very bad news related to cases of COVID among detention officers in the past week, and then I guess one death, which is very sad. My question is, do we as yet have any cases that you know of among inmates?
I'm in contact with the sheriff, and I will say that it's my understanding that the sheriff may be on the call, and I dare not speak for our sheriff. Definitely a man who can speak for himself, but I can say that we maintain great communication, and when this COVID began to rear its ugly head, the sheriff did take action, and he did open dialogue with me, and any information that I got my hands on, I made sure that he had it readily available. Him and his staff put a great plan in place, and to my knowledge, Commissioner Reckhout and other commissioners, there are no inmates that have COVID. The majority of the situations have involved other staff members, and again, there were staff members who lived in other counties, and the unfortunate thing is, they have to work, and the minute that they exhibited signs and symptoms, they were sent home, and majority of people were self-quarantined, and it's allowed us to weather the storm thus far.
Well, if that information is correct, then that's a blessing to date. We just have to keep our fingers crossed, because obviously in a facility of that nature, once it gets into the population, it's bound to spread pretty fast. Although it'd be interesting to know, Jody, do you know whether they're using any social distancing, given that we have the jail population down in the mid-200s, so that it's not very full, fortunately?
Commissioner
Reckhout.
Commissioner Reckhout, this is
Go ahead,
Sheriff
Sheriff.
Burkett.
Thank you,
you,
Sheriff.
Jody. Yeah, we are practicing social distancing, and like Rod said, I appreciate Rod the information shared. So we're able to practice social distancing as best we can. We are also moving inmates in smaller groups to let them exercise, go to the day room, library, things of that nature. So we're doing really well under the circumstances, and thankfully no cases, no inmate cases as of this communication. And Mr. Jenkins is correct. We
have been running a very tight ship with our employees while they are at work. Cannot speak for when they leave and travel to other counties, but so far we've done a really good job. Our staff, both our staffs, public health and detention, and our staff at WellPath communicate by the minute if there's any changes. So population being at 256 earlier today does help and allows us to be a little more flexible with the current inmates that we have.
Well, thank you for that very good news, and I want to thank you and your staff, because keeping the inmates in the jail safe is not an easy task with this virus raging, and so I really extend thanks for a job well done to date, and just try to keep up the good work, but that's terrific to date, so thank you.
Okay, great questions, Commissioner Howerton. Other commissioners, comments or questions?
This is Heidi. I have a couple comments. First, I just want to really express my admiration for everyone that's a participant in the EOC. I just continue to be amazed at how you all manage to do your regular jobs and deal so effectively with the crisis, and also want to express my appreciation for that. And the jail population being at 256 is absolutely amazing. I don't feel like I've ever heard it that low. And I know that the sheriff and the district attorney have been working really hard on various strategies for getting it that low. And I really, take my hat off to you for that. I was so excited to hear all the different things that are happening in the public health realm. The number of tests per day going up, that Walgreens drive-through COVID testing sounds pretty incredible. I'm really pleased to hear that we're increasing our number of contact tracers. I think that's just hugely important. And all of the new data, the data hub and the working with DataWorks, so that we can see whether our local trends are mirroring the metrics that the state is monitoring. I think that's fantastic. Can I ask just one more question about the contact tracing? I'm just wondering, how many investigators or tracers do we currently have? How many do we have normally? What's a normal sort of everyday, not during a COVID emergency number? And what are we trying to increase to? Do we have a goal that we're trying to meet?
It's a great question, Commissioner Carter, and I would say it depends. We have so many different kinds of contact tracers. We have your traditional CD, communicable disease contact tracer. We have environmental health specialists that handle outbreaks, food outbreaks, and they do contact tracing. And then, of course, we certainly have some other forms that it just takes many different forms. So, I mean, to address your question, on a normal day for our epidemiology team or our CD team, we may have upwards of 4 or 5 nurses that do different functions. And as it stands right now, we have a team that's sort of a kind of a mixed bag, if you will, but they're doing a fantastic job. We have nurses, we have environmental health specialists, we also have, to break down nurses, we have school health nurses who traditionally would do school health activities, but they're not in school. And then we have our traditional CD nurses that this is what they do day in and day out. Ultimately, we would like to have as many as we can, but as it stands right now, I think we're on different shifts. We may have upwards of about 20, and they're working hard, and the work is arduous. I mean, when you're talking, just to give you an example, when you're talking about a team that's doing about 950 contacts per day, that's a lot of people that they're talking to. So, again, we have not wavered away from doing contact tracing, whereas we received some additional, some different guidance when COVID became real hot and heavy, and it allowed certain health departments to prioritize contact tracing. They could just determine whether or not certain cases were high priority, if you will. We treated every case as a high priority, so that allowed us to go back 48 hours and to retrace the steps of that particular person who tested positive. And as a result, we've garnered success in reducing community spread and things of that nature. So, I mean, ultimately, 20 were fine. I check on them all the time. There's not a day that goes by that I don't go upstairs from the EOC, excuse myself, to go up there to just thank them first and foremost for the work that they do, and to check on them just to see whether or not they have all that they need, whether or not there's any other resources that they may need, Commissioner Carter. And so far, the word that I keep hearing is we're fine, we're okay. But again, when Duke made the offer to, have the physician assistant students to come join us, of course, we're not going to turn that down because that's just expanding our bandwidth. So, so far so good. I think we're fine. I just expressed to the team that CCNC is offering the opportunity to contact trace with that workforce, and I just asked them, please, take a look at our operations. I mean, we don't want anyone to get burned out. So if that's going to be able to further increase our bandwidth, then maybe we'll explore that option. But there are some health departments that are a little reticent to do that. But again, I believe in taking care of our staff so they don't get burned out. I hope that answers your question.
No, thank you so much for that answer, Rod. I am really happy to know that you're so supportive of the contact tracing, and really, I know how critical it is, and I just really hope that you won't be shy about letting us know, letting the manager know, and letting us know if you really want to increase your capacity to do more contact tracing. I know Massachusetts is training a corps of volunteers to become tracers, and they've set this goal of 15 tracers per 100,000 residents, and if we were trying to do that, that'd be 45 tracers. So we're getting close to it. Wuhan, on the other hand, has 81 tracers per 100,000. That'd be 240 for Durham, and they've really done a good job there of shutting down the virus. So I'm glad the state's going to provide some support, and I'm glad we're taking advantage of every offer of help that we can get.
Absolutely.
Really appreciate your leadership. And the only other point I wanted to ask about was social distancing on the American Tobacco Trail. I've had a number of people contact me about that. They don't think people are being aggressive enough. Maybe people don't know how to social distance on the ATT. Just wondering if you have heard that, or if there needs to be any additional education around that. Maybe Parks and Rec would be responsible for that. It is, after all, a city park. Wondering what you're that.
I would say I've not heard that. Of course, we're always in favor of people being able to get out and exercise. Again, that's a great public health behavior. But I would encourage Parks and Rec to really monitor that activity if they're able to. But no, ma'am, I've not heard anything about issues with social distancing for those who are exercising.
Okay. Well, I'm really, really glad that we are still encouraged to use the trails and things like that in Durham. I agree with you. That's really important. I'll follow up with a city council colleague about that then. Thank you very, very much, everyone. Thank you so much.
Well, thank you.
Anybody else? Any questions for Jim, Leslie, or Rod? Wow, well, I'm just so appreciative of all the information that you all have shared with us tonight. This has been a very complete report, and just I think the leadership that Durham County has taken in so many areas with the contact tracing, with the work that we're doing around trends and data and testing. I mean, Rod, to hear that some of the news that you shared tonight about Walgreens doing free drive-through testing is going to be fantastic for our community. The radio shows and weekly calls with the Latinx community, and the fact that 33,000 views already on the Data Hub. And, as we've seen, I'm sure people are reading the news that some places in the country and some counties are not sharing as much information as we are, and I think it's important that we are providing as much public information as possible without, disclosing anything personal to help educate our community. So again, so appreciative. I did want to follow up on one issue. I did want to mention too, Rod, I know you sent us actually a detailed strike plan, long-term care strike plan.
Yes, ma'am.
And I just want to mention that related to Commissioner Reckow's comments, that you have sent us that, and appreciate that. And to note also that Covering the Triangle has provided some face coverings that were distributed to some of the nursing home facilities and also to the detention center. I just want to confirm that, right?
To my knowledge, that's accurate. Yes, ma'am.
Right, okay. So Rod, related to Ellen's question about more things that we could do you feel like that would be some way that we could help, between the 22 facilities? I mean, let's face it, I think some of the disparities we're seeing, why is Crosdale have none and some of the facilities have a lot? And I think it's based on the resources that they have. I mean, you alluded to that in your comments. You said some of them are older, they have more challenges. So I think economically there's a big disparity between our different long-term care facilities. And I've read, and I think you've referenced this as well, Rod, that we have some places where workers are working, more than one job. A lot of these workers are really low paid. There's issues with the reimbursement that they get from the state or the federal government. And so, unfortunately, there are some systemic issues. So I would love to hear do you feel like something like face coverings, could we help support, or are there other resources that we could help support with the ones that are maybe struggling more?
I tend to try to be an equal opportunity public health director, and I would say if this is an initiative of my board of county commissioners in Durham, I would say, if we could pass them on to everybody, it would be great. My weekly message just last Friday really focused on cloth face coverings and how important they are for mitigating respiratory droplets from going out of a person's mouth to another individual. And those face coverings were what prevents that from happening, in addition to me trying to model putting on a face covering myself. So I think this is a great opportunity to help reduce the spread of COVID inside long-term care facilities, Madam Chair, and I'm all for it. Not necessarily as my opinion, but just from a good public health perspective and practice, you just can't get any better than that.
Okay, well, really helpful to hear that. Thank you. And then I guess if the sheriff is still on the call, the questions that Commissioner Reckow was asking, has there been any, I know you were concerned about making sure that you could get people that needed to be tested, your deputies, possibly, detainees, or anybody working in there. Has there been any progress on that?
Nothing on the LEO side. Detention officers are being tested as part of the WellPath, our healthcare provider. But we've had no movement on getting our LEOs tested. I'll share the information from the call tonight, and we'll see. And I know Leslie is working on an option for us as well. But those detention officers who were potentially exposed, all of them have been tested. All of the inmates that were potentially exposed, all of them have been tested. And WellPath has put out another call for another batch of testing, if I'm not mistaken. I just don't think they've come in yet.
Okay. And then related to the courthouse, because of course that's another big site where, we have activities happening. Do some detention officers go back and forth between the courthouse and the detention center?
No, I have stopped the back and forth, so everyone stays in their assigned area, even those who are working when the staff is short. Once we assign them to the detention center, they stay there, or vice versa. So we're doing the temperature checks, as you know, at the front door and the back door of the courthouse. So everyone who enters the facility at any time during the day has their temperature checked. We went to mandatory wearing of masks anytime you're inside the public areas of the courthouse. You certainly can remove it in your own private office, but other than that, people walking around with their mask on. And I'm saying we're probably getting about 90% compliance. So that's where we are, and we really got that partition up between the jail and the courthouse. So really have reduced the back and forth.
Okay, well that's great. And just how do you feel about having what you need in the courthouse in terms of people coming in and having access to hand sanitizer stations and the cleanings, and is there any additional way we could support you, or?
Well, we have ample hand sanitizers, and the message I sent out to the judges and anyone else occupying the courthouse is that they need to let me know they need sanitizer. General Services, to my knowledge, has not placed any additional hand sanitizer stations in the building, but I think we've got ample amount at this point. What we are seeing, obviously, not everyone in the public has face masks. So if they come into the facility or approach the front doors without a face covering, I've authorized some to be given out until we run out. But again, we're telling folks, if you don't have business in the building, if you don't have an appointment, or you're not going to the clerk's office, or you're going to court, we have had to turn some people away. So that's the biggest thing I'm seeing, is the public coming into the building without a face covering.
Okay. All right. Well, thank you so much. And as Commissioner Reckow said, it's really a challenge we know, with all of our congregant living sites, the homeless shelter, our nursing homes and the jail are just where people are at highest risk. So we appreciate all that you're doing. And also for our front line, all of our first responders who are at risk as well every day. So thank you. Okay, so I guess the last item is just a quick update from Greg on malware. It'll be nice when we don't have to talk about that anymore, maybe.
Right, well, John.
Well, good evening, Madam Chair, Commissioners, and managers. First, I want to thank you for inviting me to give an update. We'll try to keep it fast. I do hate that many times I end up standing between you all and whatever the next activity is after this meeting. But as you know, some 52 days ago, we were hit with a malware attack, and just piggybacking a little bit off of the last report, you know, we've had to, everything that we've done to date, we've had to do it working in this COVID-19 environment, meaning practicing social distancing and, you know, trying to get work done while staying healthy at the same time and keeping the team healthy. And so, you know, I certainly want to thank, you know, everybody who has been supportive, not just the IS&T team, but, you know, many departments, EMS and other departments who have been supporting us since this malware attack. We've certainly had great teamwork, and I'm very proud of, you know, the IS&T team, because we continue to work since March 6th. We continue to work. I think since March 6th, we've had a team working every weekend, working to restore IT services here in the county. And since then, we've touched over 2,000 computers, 800 databases, 300 servers. We've scanned over 2 million documents. We now have recovered or restored some 50 plus software applications in the county. And so our focus continues to, you know, our priorities continue to center around rebuilding our core infrastructure, which is all of the major work in that space is pretty much done. Restoring our public-facing applications that impact our Durham residents. And again, most of that, I'm not aware of any business within the county that where they have public-facing applications that are offline at this point in time. And we continue to focus on returning our enterprise applications back online. So things like email and the HR applications and our wireless network, all of those services have been restored. And then finally, focusing on those departmental and specific / unique applications. And there are hundreds of those in the county. And so we're working with departments on a, you know, on a one-on-one, first come, you know, priority basis to get those applications restored. We also now have about 40,000 file shares that we have to restore and reassign. These are those little document folders that you have on your computers that store documents. And so again, we're working with individuals to get those files restored. So overall, the process is moving very smoothly. We haven't hit any major roadblocks to slow down the process, other than having to practice, you know, the COVID-19 safety practices that are being put in place, and making sure that we don't have a whole lot of folks in the office, you know, taking our time to make sure that, you know, we're practicing social distancing and all of those other kinds of things. The last thing I'll say is that, you know, we're also supporting departments with specific COVID-19 technical requirements while working at the same time to roll out new tools that will assist with, you know, our employees who are having to work remotely, and bringing new capabilities online so that we can do that in an efficient and an effective manner. So that gives provides an update in terms of where we are at this point in time. Yeah, I'm very happy with the progress, very proud of the work the team has done, and you know, the work continues. As I've said before, this is a long process, but those major applications, I can say I feel very comfortable at this point in time that they have been restored. We still have a lot of work to do. We asked everybody again to, to be patient with us. And the last thing I'll remind everyone is to be vigilant. I just got an email last week myself. It was sent to someone and they were diligent enough to catch it. The email went to them and it was a request to change my bank account due to COVID-19. And so these COVID-19 emails are certainly getting through, and so we have to be vigilant and make sure we're not clicking on fraudulent links or phishing attacks. I certainly don't want to repeat this process anytime soon. So, Madam Chair, that's my update for today.
Well, thank you so much, Greg. I heard Commissioner Howerton laughing because she knows what that's like. She's been through that, and and I will say I have been the victim of fraud myself. I didn't click on any bad emails, but I ordered some masks from a company online, and it turned out it was a fake company. So it's sad how people are really trying to take advantage of this situation that's happening right now, and so. And we need to threaten all employees that if somebody does it again, they're going to have to be the one to fix it. But anyway, appreciate all of your ongoing efforts, and especially as you said, it's incredible how many employees that we do have teleworking now, and that's also, of course, thanks to what you all are helping to support. So any other questions from board members?
I have first of all, Greg, thank you so much for your dedicated leadership digging us out of that huge disaster. I really appreciate it. I've been contacted again in the past few weeks by the person who I forwarded his email to you several months ago, lives in northern Durham, and he's basically saying this COVID situation is showing the need to have broadband across our whole county. Are we, I know you were looking before the cyber attack at avenues for expansion. Did you find any fertile ground, and are you going to be able to go back to that at some point in the near future?
Yes, so our intent certainly is to circle back around. We did talk to a public utility company who works with an organization, and what they would like to do is to do an engineering study to assess what it would take to deploy broadband in that area. Normally step number one is to do an assessment, an engineering assessment, and so that's kind of the next step in the process, is to commission an organization to do an engineering study for us. That study, then we would be able to give to an internet service provider and say, basically, what would it take to do this? And then they would develop a business case to justify whether or not it would make sense putting in that kind of stuff.
Mm-hmm.
So
and then another area, though, of really great need is the whole issue of trying to get our families with children internet access. Have you been in any conversations with the city IT staff and the school district IT staff about any possible avenues to begin to move that forward? Because I understand we could have a third to a half of our families with issues around that.
So,
Even
so
if
I,
we could get them the devices, they couldn't necessarily get on the internet.
yeah, I have talked to several on the city side, and, most public schools are trying to address, the digital divide, but you're right, in some instances, it's more than just providing, internet access. Most public schools are now outfitting school buses with wireless technology, and so the school bus may get parked in an area where families can connect um, to the internet, and so that's a service that both Wake County and I believe Durham County, at least on the public school system, is looking at and rolling out. Um, I know there's some organizations trying to provide, basically MiFi devices at no cost, and I think I've shared some of that some of that information with Commissioner Jacobs as well.
Okay. Well, yeah, if we get another surge, it would probably behoove us over the summer to really, as a community, pull together a plan. I was talking just the other day with one of the school board members about the need to maybe develop a plan around this. And would we have any computers that are on the brink of being recycled, or where we buy new computers, I guess every 4 years or so, that could be refurbished and put back out for students? I was reading recently about a district, actually I think in this state, that's doing a lot with refurbished computers.
Yeah, so as you know, we donate most of our computers that are outdated to Camden Institute.
Mm-hmm.
And then many families get computers, at no cost through Camden Institute.
Yeah, I wonder, because in a given year, the city, the county, and the schools, it'd be interesting to know the number of computers that we recycle out that could possibly be refurbished and then given back out to students.
I don't have the numbers in front of me that we give to Camden, but Camden takes those computers and refurbish them, and then provide them to needy families in the community.
Mm-hmm.
Yep.
Okay. All right, thank you, Greg.
You're welcome. Thank you.
I just want to follow up on the great points that Commissioner Recca was just raising. Greg has shared. I can try to find those emails and send them out again, because I think the whole board was on them. But two issues. One is, how do we get broadband out to those corners of Durham County that are just not covered by any company? And I will re-forward that email out that he sent, because it's something that we may want to discuss again with our board discussion about priorities for our budget. And I think that this is a more important issue than ever, an equity issue that as we're looking at the next year to 18 months, and people have to work from home, and children have to learn from home, and even we've got college students that are at home now doing classes, that the the double whammy of not having internet access plus not having the computer. And so, these are the kind of things I think our board needs to discuss in a different landscape that we're in now. It takes up a different focus and sense of urgency. And the digital divide for Durham Public Schools is 3-to-1, is the ratio that I've heard the school board chair use. And I know that they are working on some proposals. And actually, the mayor asked for suggestions today about joint city-county meeting, and I suggest, he is suggesting that we have a joint meeting of all three of our boards, the school board and our, county commissioners and city council at that time, and I think this would be an excellent thing for us to even put on the agenda, that we could all discuss this issue of internet access and digital access, and how we all can work on this together. So thank you for raising that, Commissioner Reckow. Any other comments? For Greg, or questions? Okay. Well, thank you so much for all the great reports and information. And the last item on our agenda is boards and commission appointments, and I will turn that over to you, Lowell.
Madam Chair, members of the board, I have the results of your voting for appointments to the Durham County Hospital Board. For the community physician representative, you can select one person. You selected Rosemary Jackson. For the community representative position initial term, you could select one person, and you selected Whitney Steele. For the community representative position unexpired term, you could select one person. You selected Denise Barnes. And for the Durham Regional Hospital representative position, you could select two individuals. You selected Marshall L. Legolan and J.H. Kemp. That concludes your voting.
Well, thank you. And I guess just for anyone who's listening, what we did, do you want to explain how we did that?
I want to thank and commend the board for working on our modified process due to our meeting being remote. And essentially, the commissioners received the ballots in advance, and they actually did the voting prior to the meeting. And those were submitted to me just prior to the meeting. So that's our format for this period during remote meetings.
Okay, thank you. I don't think we voted that instantaneously.
Never.
Yes.
Great job.
Right. So thank you so much. Okay, so I would entertain a motion to adjourn.
So moved.
Second.
Okay, moved by Commissioner Reckow, seconded by Commissioner Hill, and then we will vote, and I'll start at the other end. Commissioner Carter?
I'm in favor of it.
Okay, Commissioner Hill?
Yes.
Commissioner Reckow?
Yes.
Commissioner Howerton?
Yes.
And I'm a yes, so we're all in favor, and thank you again, everyone, for being a part of the meeting tonight, and we are adjourned.